Hello, everyone. We've got just about another minute, and we'll start in just a moment. Okay, it's 3 o'clock. Hello, everyone. My name is Jonathan Martin. I am the National Director of Programs of the American Liver Foundation, and I'd like to welcome everyone to today's webinar, made possible in part with support from Alexion Pharmaceuticals. I would like to thank Dr. Mehal from Yale University School of Medicine, Professor of Medicine and Digestive Diseases and Director of the Yale Weight Loss Program, and Jessica Dean, Registered Dietitian and Certified Dietitian Nutritionist, who will be sharing their expertise with us on today's webinar. Let me just start with a few housekeeping items. On the upper right-hand side of your screen, you should see a dialog box. If you don't see it, there's an orange arrow that you should be able to use to expand that box. That's going to be how you're going to be able to answer questions and participate in today's webinar. You can type your question in at any time. We will be saving them all for the last 10 to 15 minutes, and we will get to as many questions as possible. Please do try to keep your questions general, as our guests today are not in a position to be able to provide specific medical advice, but we will do our best to answer questions in as efficient a way as possible, and we would welcome your participation, so please do send those questions in, and we'll get to as many as we can. So I'd like to go ahead at this point and turn the slides over to Dr. Mehal, and let me just make sure I've got you with control of the mouse, and you should be good to go.
Yes, good afternoon, everybody. So over the next 20 minutes or so, I would just like to go over some basic aspects about NASH. And this really, it has been an amazing phenomena in terms of how quickly this disease has, become so common and how much harm it's causing. So everyone is sort of coming to grips with this, and that's what I'd like to go over with you over the next 20 minutes or so. So the slide you have up there at the moment really shows the prevalence of liver diseases in the US approximately at the moment. And I won't go through all of them, but the main point to make is that the circle in the sort of the top right-hand side that says NAFLD is a condition which affects 30% of the US population, which obviously is a huge number of people. And within this group of patients with NAFLD is a subgroup of NASH, which is about 6% of the US population. And this sort of just wanted to give you a visual representation of how many people are affected by this. And the very big circle, of course, is the whole US population, and also how it compares to other liver diseases. Fortunately, hepatitis B and hepatitis C, which are more on the bottom right-hand side, are decreasing and becoming more manageable because of very effective drug therapies. So that's sort of the scale of the problem. But I'd like to next go into what exactly it is that we mean by these terms, because they're slightly unwieldy terms. So I'm trying to forward here. Oh, here we go. So definition. So NAFLD, which is the 30% of the population, stands for non-alcoholic fatty liver disease. The non-alcoholic is obvious. So this is occurring in people who don't consume very large amounts of alcohol. And fatty liver disease is also just that this is a condition where there is excess fat in the liver. And when I say in the liver, I mean actually inside the cells of the liver, not just in between the cells of the liver. And then NASH, which is something that is within the NAFLD group, and about 6% also is in patients who are not drinking excess alcohol. But in these people, there is something called steatohepatitis. Steato just again means fatty, and hepatitis means that there's inflammation. So at this point, there's actually damage occurring to the liver. So those are the terms NAFLD and NASH. And briefly, if we just sort of pause and ask ourselves what the liver does, because unlike perhaps the heart or the stomach, it may not be immediately obvious what the liver does. Well, it does many, many things, but one of its main functions is to actually be a factory for the body. So there are obviously many, many chemicals that the body needs to function normally, and the liver produces a large amount of them. In addition, the liver actually receives almost all the blood that comes from your intestinal tract. So it's the first place where toxic molecules either from from plants or from chemicals or drugs, and also from bacteria are actually filtered out. And then in addition, and what's relevant to NASH is that actually it stores substances for a time when they might be needed more. And in this case, actually it stores fat, and that's how it gets this steatosis. If we then switch to actually looking inside the liver and ask ourselves what is going on inside the liver and NASH, so you will see three different sort of images here, and these are how the liver looks under a microscope. And in the top left-hand side, you'll see basically all the pink area are liver cells, and then these sort of white areas are actually droplets of fat inside liver cells, and that's just called steatosis. And this really is a healthy, normal response whenever we have a state of overnutrition. So, currently and, forever at times, people would have a state of overnutrition. So it may be, the olden times, it may be maybe hunting a deer or something, and for a day or two, you would have an awful lot of deer meat. And the liver would just store the extra calories, they should not be wasted. They're necessary, and then typically they would get used up over the next few days and weeks until there was another, big source of calories. However, what's happened in the modern industrialized world is that there's basically a chronic state of overnutrition, which is something that we haven't had to face as a population pretty much ever. It's been overnutrition interdispersed with either, poor nutrition or downright famine. So when there is just this chronic state of overnutrition and the liver loads up with these lipids, but it doesn't get a chance to offload them, then you see that image on the right-hand side, which says inflammation and liver damage. And there you might be able to pick up these sort of very black, or not very black, but many of these blackish dots. And those are really immune cells that are coming in and damaging the liver because the liver is just under too much stress. And that state could exist for decades, and that's what people with NASH have. They just have this decades-long, low-level inflammation injury occurring. And then after maybe 10, 15 years of that, you'll get the image, which is at the bottom of your picture, where the blue is actually scar formation. And at that point, the liver, it's a gradual process, but when it's completed from F1 being the initial and then F4, the final stage, and F4 is basically the common term for that is cirrhosis, which most people come into contact with that word in relation to alcoholic cirrhosis, which still does occur, or it still does exist. But once a person has cirrhosis, it actually doesn't matter whether they achieve that point from alcohol or from NASH. So this is a very alarming progression that occurs in patients with NASH. Now, if we look at what the population implications of this are, then one factor to keep in mind is that the stress on the liver, it's a crude indicator, but it is an indicator, is basically the person's overall weight. And admittedly, it's a crude indicator. There are a few people who have a high body weight because they are extremely muscular, and these typically tend to be younger people and typically, obviously, athletic people. But the vast majority of people who are overweight are not because they're carrying too much muscle, but because they're carrying too much adipose tissue. And here on this slide, I've just listed on the left-hand side people, heights, and above a certain weight, person would be considered overweight. So, for example, if we take 5'9", after about 170 pounds, an individual who's 5'9" is carrying too much weight. Okay, and after about 200 pounds, they actually would be technically obese, and that's just a medical definition of obesity, which is based on risk of death from obesity-related issues. So I would encourage you all, just take a second. Obviously, most of you will know what your height is, and most of you may know what your weight is, but just sort of identify where you fit within that range. And the reason I'm being so concrete is that most of us, even healthcare professionals, are very bad at identifying people who are overweight and obese. And we, simply because so many people are overweight, that many people who are overweight, we look at them and sort of think, well, they're sort of okay. But actually, if you weigh them, they're actually overweight. So please, just take a second and identify where you are on that spectrum of being overweight or being obese. In addition to weight, the other risk factors are where the weight is. So weight around the middle, the abdomen, is more harmful for the liver than weight if it's on the hips or the shoulders or anywhere else. And obviously, sort of this abdominal obesity is more common in men than women. And then other obesity-related diseases. So if somebody has diabetes, they're at greater risk. If they're carrying weight but actually have very low muscle mass, essentially don't have much muscle, then that's a risk. The older we are, the greater the risk. The greater the family history, the greater the risk. And then there are some, rare genetic causes that can result in a disease that looks very much like NASH. And at the bottom, you see this condition LAL-D, which can cause a NASH-like type picture and is present in actually a very small number of people, maybe 1 in 100,000. If we ask the question how big a problem this is, on this curve, on the red line, you'll basically see cases of liver cancer from NASH, and as you can see, they're just upswinging. The blue line is actually cases of liver cancer from hepatitis C, and you can see they're sort of reached a peak and are predicted to start going down from 2020 because of the effective medications. But just to point out that this disease is not a minor disease or a disease of academic interest. This disease is hurting large numbers of people by causing liver cirrhosis as well as causing liver cancer. And then what's even more alarming is if we look at the incidence of NAFLD in the community. So this is data between 1997 and 2014, and you'll see 3 curves there, red, blue, and sort of a greenish color. And as you can see, with 1997 being on the left side, and as you move towards 2014, all of the curves are going up. And I'd like you to pay attention particularly to the curve at the bottom, which is the green curve. And that's in looking at age population that was around between 18 and 39, or say 20 and 40 in 1997. And the point being that the biggest increase is actually occurring in people who are relatively young. So this is not a disease that, we can say is limited to, say, elderly people or something like that. Unfortunately, this is affecting people across all age groups. And I haven't shown you children there, but actually it's becoming a real problem in children as well. So from this sort of overview, I'd like to, again, just ask the question, what do we actually see in clinic? What does somebody with NASH, how might they present? And this is just a very simple, if you like, story of that. And this is somebody actually I saw in clinic a few weeks ago. It's a 52-year-old patient who's an attorney, 5'9", 205 pounds. So slightly, technically obese, but if you saw an individual who's 5'9" and 205 pounds, you might say that they're slightly overweight. They take very little alcohol, just has mild high blood pressure, actually feels perfectly fine, have a normal exam, but the AST/ALT are slightly elevated. These are the blood tests that people check, and other labs are normal. And the point being that, these are people who basically look well and feel fine. And most patients with NAFLD and NASH don't realize they have this condition. Secondly, patients don't have to have a very high BMI. So, we shouldn't have this picture in our mind of somebody who is, say, 5'9" and 300 pounds or 330 pounds and say, well, that's the type of person. I'm not 300 pounds, so therefore I don't have to worry about this. Unfortunately, this is not true. Even a modest amount of being overweight, by modest I mean 35 pounds, can be enough to put someone over into this condition. And some people actually have a BMI of 25 and can have NASH as well. In addition to weight, if somebody has metabolic syndrome, so diabetes, high blood pressure, gout, things like that, that increases the likelihood of NASH. The AST/ALT, if they're elevated, are certainly helpful as little red flags, but they're not sensitive. Many patients with NAFLD and NASH have normal AST/ALTs because the level of injury is actually quite low usually, or might be intermittently elevated. And then the alarming thing is that actually this individual actually presented with cirrhosis. So, for this particular individual, or for anybody, who thought they were fine, all of a sudden to find out that they have cirrhosis is really very catastrophic. And this is exactly the type of situation we're trying to avoid by trying to identify people when they're earlier on in the stages of progression in NASH. And we know that roughly progression of fibrosis occurs over about 3 to 5 years in terms of one grade from F1 to F2. So at the bottom, you'll see that, patients can be sort of grouped into 2 broad categories. They could have fatty liver, but normal at liver function test, that's the AST/ALT, or they could have fatty liver with elevated AST/ALTs. And both of those groups actually need workup. In terms of symptoms, I've already mentioned most people feel fine. Some people may feel tired and fatigued, particularly if they have some fibrosis. And the point there is that if someone goes from feeling very robust and vigorous to feeling somewhat tired, but it occurs gradually over 10, 15 years, it sort of becomes their normal, and they may not actually even realize and even say to anybody that they feel tired, because that's just the way they've been feeling for a number of years. If nothing is done, then the later symptoms are actually very alarming. They can develop ascites, which is the abdomen filling up with blood, frank jaundice, which is what many people identify as severe liver disease. There can be pruritus, which is itching, and with cirrhosis, patients can have life-threatening internal gastrointestinal bleeding, which presents as vomiting blood. At the moment, this whole area of NASH is a huge area of clinical drug development. There are probably approximately 50 clinical trials underway at the moment, trying out different agents and different combinations of agents. I won't go into any of them because there are lots of them and none of them have been approved. But the bottom line is currently there's no approved medical pharmacological therapy for weight loss. There is, however, some good news amongst all this bad news. And the bad news, as I said, was that there's no medication identified. The good news is that even moderate weight loss is very helpful, okay? And by moderate, you'll see on the bottom left, I've got some figures. So if somebody is, 250 pounds, and if that person was 5'9", then they're approximately 80 pounds overweight. And that's a lot of weight. If the case was that they had to get from 250 to their ideal body weight of 170, that's extremely difficult and almost impossible. However, we do know that if patients can just drop about 10% of their weight, so go from 250 to approximately 225, that their liver disease, the NASH, will improve to some degree. That's not to say that they'll have a normal liver, but there will be, demonstrable improvement if we were to biopsy them. So that's the good news. So keep that figure in mind, that a 10% weight loss is very helpful. And it will, of course, be helpful for other conditions that patients will have, diabetes, high blood pressure, etc. So, just because it's difficult to obtain perfect weight, please don't, stop trying to improve your weight. Main ways to reduce weight are, the first step always is nutrition, and you'll hear more about that in a few minutes. So improving nutrition, reducing alcohol, and here I'm not speaking about people who take excessive amounts of alcohol. The national guidelines are, 2 drinks a day on average for men and 1 drink for women. But keep in mind, those are guidelines for people who are otherwise in excellent health. And I would encourage you to view each drink of alcohol as basically a candy bar, because apart from any alcohol-related toxicity, it brings a lot of calories with it. So if somebody's already overweight, then to have a lifestyle where they're taking 2 candy bars in addition to their normal nutrition clearly is not helpful. And then also increase in exercise. This data, I'm actually not going to go through this in detail, but this is actually data which supports that 10% weight loss will result in improvement in the liver histology. And there's a reference in the bottom right if you wanted to go into that in more detail. And then for the next about 5 or 6 slides, I'd like to go through somewhat quickly as to the reasons as to why we are obese. And again, I'm going to go through this quickly because this by itself is potentially a very large topic. And really the issue is that, we were essentially designed to not live in an area of high nutrition, but to be hunter-gatherers. And most of the time there would be not much food, and occasionally we would catch something. So, calories were, high calorie food was briefly available. It was unpredictable and there was no storage. So one way to deal with that is to basically consume as much as possible, even if we are quite full at the time, because we're just storing it for hard times. And because of that, what's happened in the last 80 years is that, as you see the picture on the left, this gentleman who may have walked into the store, he had to have a conversation with somebody to get some food. He's probably walked there. He has to carry the food out to go home. He has a limited amount of money on him to buy things. He can't spontaneously buy whatever he might want. And the picture on the right will be familiar to all of you. And I've intentionally not actually mentioned the content of the actual food, which has also changed dramatically. And I won't go over this much more, but there's an awful lot we could talk about for an hour just on the differences of what we see in these two sets of images. So two things that are not effective, and it's important to know that, and I'm not effective for weight loss per se. So one is exercise alone. So for most people, going to the gym 3 or 4 times a week by itself will not result in massive or 20, 30 pounds weight loss. It's really about nutrition. Having said that, it's still really helpful to exercise. So although the weight won't go down, you will actually be much healthier. You'll have more muscle. It's good for blood pressure, diabetes, etc., etc. So do exercise, but don't expect that by exercising, in the normal sort of sense of the word, that you will actually lose much weight. And the second is people tend to over-rely on willpower. So simply saying, well, I've changed my mind, or I've made up my mind, I'm not going to have dessert, isn't that helpful. It's much more helpful to change your microenvironment such that dessert doesn't come on the table after dinner every evening, if that's what tends to happen. Okay, so change your environment, you can't do anything about all the fast food places around you, but you can certainly change your microenvironment. What's in your fridge, what's in your freezer, what's hitting the dining table, okay? I'm actually, just to make one point, it's actually very difficult to lose weight. So if somebody does follow weight loss advice and goes from the McDonald's meal on the left to a healthier meal, it's also really important to decrease the total amount of calories. So many people will make that A switch that I've listed there, keeping in mind, assuming that they can afford it. The meal on the right is an expensive meal. But many people will make that switch. But what's equally important is actually the total amount of food that's being eaten. Okay. Because time is getting on, I'm actually going to sort of go to the final take-home points, and which are on this last slide here. So NAFLD and NASH is the most common liver disease in the US and is causing a lot of morbidity and also deaths from cirrhosis and also from liver cancer. At risk are people with a BMI, which is a combination or calculated from weight and height, above 27. And I would encourage you all, again, just to go on to, you can Google these websites or pull up a chart and see what your BMI is. There are no symptoms until there's advanced liver fibrosis, and this is a real concern because obviously we want to identify people before they develop advanced liver fibrosis. At the moment, there are no effective medications. However, moderate weight loss is extremely helpful in preventing the liver injury and fibrosis. So I'll stop there and then hand over to Jessica Dean, who will speak to you about weight loss.
Okay. Hi, everyone. I'm Jessica. I'm the dietitian here at the Yale Fatty Liver Disease Clinic. So I hope you are enjoying the presentation so far. You might find that Dr. Mehal and I are going to say the same things, but I'll focus a little bit more on the nutrition side. First of all, I just will ask you guys if you have something close by to grab a product that has a food label on it. We'll be using that a little bit later. So I'll just give you a second or two to grab something. And the next thing I'd like you to do is just start with this self-assessment and just go over the slide and read through those bullet points and see if any of them apply to you, and maybe you could answer them either yes or no, and just note your answers. All right, so here we go. All right, so today I hope to teach you at least one lifestyle behavior that can negatively impact your liver health, and at least one positive behavior that can improve your liver health. We'll also be able to identify foods that you should incorporate into your diet and foods that you should limit. I'm also going to touch upon some exercise recommendations. All right, when we talk about health, we talk about the major players. We usually hear about the brain and the lungs and the heart. There's one more that people tend to forget about, and of course, that's going to be the liver. So we can't live without our liver, so we have to pay, good attention to how we're taking care of it. All the time, people ask me a lot about weight loss. So weight loss is a hard thing to achieve. So we're going to talk about how we can make that a little bit better for you. All right, So what does the liver do? Dr. Mehal mentioned this too. So the liver helps to filter toxins like pollutants and food additives. It also helps to filter metabolic waste. A healthy liver can do this, really easily. The liver also helps the metabolism of carbohydrates, protein, and fat, and the conversion of these macronutrients into energy. Okay. So when we first see a patient in the clinic, we want to make sure that we're ruling out some of the other liver diseases and we're just focusing on the non-alcoholic fatty liver disease and NASH. So I know Dr. Mehal went through some of the other conditions that are associated with non-alcoholic fatty liver disease. And here's a little highlight of the metabolic syndrome, which is usually associated with NAFLD. And some other chronic illnesses that also are linked to the non-alcoholic fatty liver disease, such as cardiovascular disease, diabetes, vitamin D deficiency, PCOS. So in the end, we want to make sure that our liver is nice and healthy. A healthy liver can do all those detox processes without a problem. When the health of our liver starts to decline, so won't your body's ability to detox. So I know most of you are probably thinking, oh, great, so I'll just grab some apple cider vinegar and just start doing one of those trendy detox diets. And unfortunately, this is not the case. There's not a detox diet or a juice that will fix your less than optimal liver function. So unfortunately, we have to pay attention to our diet. And I know that's not easy and it's not the easy way, but that's the only thing that will improve the health of your liver. So again, the cleanses that you hear about have not been proven to help, and they will not reverse the damage that has been done. All right, so before we go any further, I just want you to do a little experiment for me. We talked about this already. So I want you to put your hands together in front of your chest. I just want you to put your palms together with your fingertips facing the ceiling. Now, gently fold your fingers together almost like you're praying. Okay, and look down and just note where your thumb is at. So wherever your thumb is at. It really doesn't matter. I'm not going to tell you anything fancy right now. Now I want you to do the same thing, palms together, fingers up, and reverse where your thumb's placed. So if your thumb was in front, now if your left thumb was in front, I want the left thumb behind. So typically that feels a little bit uncomfortable. So we're more comfortable with whatever the first positioning was. The second position is a little uncomfortable. So I use that kind of as an analogy of, changing your diet and making new habits. That first way was really comfortable. That's how you're used to eating now. The second way was a little bit uncomfortable, but can become more comfortable over time and with practice. So when we look at changing our diet, we want to make small changes consistently over time to make that new habit more comfortable. All right. So the bad news is that when we want to change our eating habits, we kind of have to throw the bacon and fatty foods, refined oils, processed foods kind of out. We want to try to switch those out with some healthier options, such as, lean proteins, healthy fats, and carbohydrates. So these are going to be your main macronutrients. All right, so just to go over briefly what each of these macronutrients are, I'm going to start with protein. So protein helps build and repair. You want to make sure you're consuming adequate amount of protein each day. Protein is not stored in the body, so it's something that you have to consume each day. Your daily intake should be around 10 to 35%, which would mean if you're on an 1,800 calorie diet, you would be consuming between 45 and maybe 157 grams of protein each day. Typically, people are within that 20-25% of total calories. So adding in protein into your diet, you can do like hard-boiled eggs, nuts, cheese sticks, turkey roll-ups. Making sure you're getting protein at each meal and snack would be ideal. So fats, we do need to have fat in our diet. The fat-free era is gone. We all know that healthy fats are good for our body. So we want to focus on the mono and the polyunsaturated fats, like olive oil, omega-3s found in like fatty fish, like salmon. And you want to reduce the amount of saturated fats you're having. So focus on the good heart-healthy fats, mono and poly, and reduce the saturated fats that are typically found in butter, lard, products like that, and then products made with butter and lard as well. An easy way to remember if a fat is a saturated fat or an unsaturated fat is solid at room temperature. So if you think about butter and Crisco, coconut oil, those are all solid. So those are saturated fats. The unsaturated fats are liquid at room temperature. So your olive oil, canola oil, those are your good heart-healthy fats. All right, so when preparing foods, try to use those heart-healthy fats, being mindful of how much you're using each day. Again, an 1,800 calorie diet, your fat intake should be around 40 to 70 grams a day, which adds up quickly, so being mindful of portions is really important. Carbohydrates. I get asked a lot about carbohydrates. They tend to get a bad rap, but our body needs carbohydrates. Carbs are our body's main source of fuel, so we need to make sure we're choosing our carbs wisely. There's three main types, so use sugar, starch, and fiber. We want to focus on, the whole grains, beans, legumes, foods with fiber. Those are going to be your top choice carbohydrates. About 45 to 65% of your total calories should come from carbohydrates. And again, focusing on the whole grains, fruits, vegetables, beans, nuts, things like that will provide fiber as well, which is good for your heart. So aiming to get about between 25 and 30 grams of fiber each day is helpful. So a little bit more on fiber, just making sure that you are mindful of how much fiber you're taking in each day. Typically in the US, we get about 15 grams, which is about half of what we should be getting. So adding in a little bit more fruits and vegetables, whole grains would be helpful to increase your daily fiber intake. Lastly, added sugars. So there's no health benefits to having sugar in your diet, so limiting the foods that have added sugars. Your yogurt is going to have added sugar to it. Some yogurts will have added sugar. Soda, ice cream, any of those types of foods are going to have added sugar. So being mindful of looking for those sugar grams on your food label. So if you did grab a food label, just take a look at the carbohydrates, and underneath carbs, it should list fiber. It will probably also list sugar if there's any added sugar. All right, so the recommendation is for men to have 9 teaspoons or less of added sugar, and for women, 6 teaspoons or less a day. So about 10% of your total calories or less should come from added sugars. On average, men consume about 19 teaspoons and women consume about 14 teaspoons a day. So more than we should. All right, vitamins and minerals. So again, there is really no magic supplement to cure your fatty liver or make it better. It really comes down to changing your diet. You can incorporate some supplements to help, but the focus is on changing your overall diet. Supplements aren't regulated by the FDA, so you're not sure. You're not always guaranteed to get what you think you're getting. Calcium obviously is great for your bones. Want to make sure that you're getting plenty of calcium. You can do dairy and non-dairy sources of calcium. each day. About 500 milligrams per serving would be good. Vitamin D works in conjunction with calcium to help prevent bone loss. It's hard to find in food, so the supplementation of this vitamin is helpful. You can get vitamin D through fatty fish, liver, egg yolks, fortified dairy products. Generally, people do need to supplement with vitamin D. Also, people who are going through the gastric bypass surgery will need to supplement with vitamin D for the rest of their life as well, and calcium. Potassium helps with muscle contraction. Make sure you're getting plenty of potassium in your diet. The easiest example is bananas, but it's also found in dairy products, meat, fish, nuts, pumpkin. Sodium. So limiting your sodium intake. Surprisingly, the recommended amount of sodium a day is only 500 milligrams, which is a quarter of a teaspoon. So not very much. Just as an example, the Campbell's soup, which is a half a cup serving, has 790 milligrams. So we should only be consuming about 575 milligrams a day, and then one serving of soup has 790. So a lot more, there's a lot of sodium in processed foods, so just being mindful of how much, I should say, actually, I correct myself, and a quarter of a teaspoon is 575 milligrams. There was a research article that came out recently that talked about coffee and the benefits of coffee. All right. So overall, your eating style should look like a Mediterranean-style diet, more than a low-fat diet. So this diet focuses on fruits and vegetables, whole grains, legumes, nuts, limiting red meats, and incorporating those heart-healthy fats. Breakdown of Mediterranean-style eating guidelines. So this may be something you want to print off later, just to help you plan maybe weekly meals or eating patterns. All right. A sample day of how to incorporate those suggested serving sizes and daily recommendations. Here's a sample. All right. So you can try meal planning yourself by breaking down the recommended intake. So nuts, if you did like grains, fruits, dairy, and protein at breakfast, you could do something like oatmeal with, oatmeal would be your grain with maybe apples. You can make the oatmeal with some milk and a hard-boiled egg on the side. Having a little template is helpful when planning your meal. Also important with nutrition is paying attention to serving sizes and being mindful that serving sizes is very different than portion sizing. All right. So when reading your nutrition label, be mindful of how many servings are in a package. Looking at the nutrients that you should limit, such as fat, saturated fat, cholesterol, and sodium, which are in the yellow, and focusing on the nutrients that are in the blue. All right, exercise. Really quickly on exercise, thinking about how much you sit in each day, how much you get up and move. Is your job sedentary or is it active? So all those things need to be considered when we're thinking about someone's physical activity. It's not just about going to the gym in the morning, it's also about how much you move during the day. Like Dr. Mehal mentioned as well, exercise doesn't always or most likely won't lead to weight loss. Nutrition is the foundation. Exercise does help with weight maintenance. So making sure you're getting in at least 150 minutes of moderate intensity exercise a week is helpful to keep the weight off. Of course, there's no magical number. Everybody's very different. So trial and error to figure out how many minutes is best for you. There's a lot of benefits to exercise beyond just weight maintenance. So try to find something you enjoy and get out there and exercise. So when starting an exercise program, start slow, especially if you're not used to exercising, start nice and slow. Most importantly, find something you enjoy doing. Exercise shouldn't feel like torture, it should be enjoyable. So find something you enjoy and try to do it most days of the week. All right, so think of something, whether it's weightlifting, running, CrossFit, Orange Theory, YouTube videos, something that you enjoy doing and write it down. All right. So take a brief second, just think of one fitness goal that maybe you can start to incorporate today. Maybe it's taking a walk after the webinar or taking a walk when you get home from work. And then the same with nutrition. Think of one thing that maybe you can change starting today. Maybe it's not having your nightly dessert, or maybe it's having a salad with dinner. So figuring out one small change that you can start to incorporate. All right. So just to review the objectives, kind of look through and see if you can answer them. All right, and just to summarize, the best way to fight against NAFLD is through diet and exercise. So reduce those saturated fats, focus on your whole grain carbohydrates and fiber. Watch the added sugars in your food, so read those food labels. Add in some exercise, both aerobic and weight. Establish a good eating schedule. Learn your proper portion sizing, so maybe refer back to the slide that showed proper portion sizes, realizing that they're different than portions. And avoid your sugary beverages and alcohol. All right, that's it.
Okay, thank you very much to both of our speakers. I think this has been really great, and we do have a bunch of questions that have come in. Some of them are a little specific, so I'm going to see if I can try to reword them a little bit to make them a little bit more general where I can. But let's just go right back up to the top. And again, some of these, you may have touched upon some of these, but I'm going to go ahead and just ask them anyway, so it certainly doesn't hurt to review if it's something that is a little repetitive. With a MELD score, fatty liver that's advanced to cirrhosis and a MELD score between 7 and 11, what is the best diet to do to keep that score as low as possible? I think, Jessica, I think you did touch on that. But is there something specific other than the low fat?
Mediterranean?
Yeah.
So wait, what was your question? Is there something specific in the diet?
Yeah, what is
MELD
the best diet? I don't know that there's one specific diet. I think you talked a lot about.
No, so I think essentially, there's essentially everything that Jessica said would be applicable. All the advice about nutrition would be applicable. One thing not to do is to cut out protein. Sometimes patients, when the patients with cirrhosis are told to cut out proteins. And I wouldn't do that. I mean, that's rarely necessary. So most patients with cirrhosis do still need to take an adequate amount of protein. And then the other thing to do, even when somebody with NASH has developed cirrhosis, is to, and at this point, it should be under medical guidance, not just on your own. And obviously, depending on what your BMI is to try and obtain that 10% weight loss. It will still, like most patients, will still likely have a high BMI, but under medical guidance to try and lose some weight.
Great. So I'm not surprised. The milk thistle question has come up. What would you say about milk thistle?
Yeah. So it really depends on how much evidence, and everybody, whoever wants to take milk thistle, need to ask themselves this question: like, how much evidence do you need before you start doing something? And if the evidence you need is simply that an acquaintance mentions that milk thistle is helpful for liver disease, then that's one level of evidence. If you actually need data, like demonstrable data that people who've taken milk thistle are actually improved, then the second type of evidence isn't there. There's a lot of opinion out there. So if you want to base, your own behavior based on people's opinions, then that opinion is out there, and you can find opinions that milk thistle is helpful for liver disease. If you ask what's the evidence, it's really not there that milk thistle helps people with liver disease. There's animal data, but obviously, we don't recommend changes in human nutrition and medications simply based on animal data.
Just as a follow-up to that, on sort of following that logic, is there any evidence that there is harm in milk thistle? So if people do want to try it based on opinions and word of mouth from acquaintances, is there any reason to feel like they may be harmed from it?
So then there's a practical aspect that, there are a variety of products out there. And, even the same box with the same label that someone happens to get every month, it's completely unregulated. So you don't actually know what's in there. So you may not even be getting milk thistle is one thing. And then in addition, you don't know what else is in there. So even if milk thistle by itself as a chemical isn't harmful, the practice of going to these, whatever place is selling it and picking up different items, I think that definitely can be harmful because you're picking up herbs and roots and things that you actually have no idea what's in there because it's completely unregulated.
So I think the regulation issue is a good point to make, that you don't know what you're getting is really the takeaway there. So
right.
Buyer beware. Okay, great. Some more dietary questions. This gentleman reports that he has lived his entire life at 76, has lived his entire life as a vegetarian, and has maintained a steady weight of 145 pounds. Any specific dietary suggestions for a vegetarian to make sure that they're getting appropriate nutrition?
I think with vegetarians, you have to make sure you're getting an appropriate amount of protein in your diet, and not focusing on just one source. So getting a variety of different plant-based proteins. Vegetarian diet, it's a little bit easier than being a vegan, to get all the vitamins and minerals, but you still have to be mindful of getting a good mix and variety. So typically with vegetarians, I suggest tracking your protein using an app just to make sure you're getting your recommended protein in the day. And making sure you're getting a variety of fruits and vegetables as well. I think
a multivitamin a day may not be a bad idea because there's some vitamins that are really only found in animal products. So over time, you can become deficient in those.
Yeah, for sure.
Excellent. Question about some of the statistics that are often used, and I believe you mentioned it in one of your early slides. About 30% of Americans with NAFLD. Is that including children, or is that a separate statistic? Is that
so that's mostly from the adult population. There's not surprisingly less data in children, but because of course the other thing with children, of course, is that a group of 3-year-olds is very different from a group of 13-year-olds. So you have to sort of start defining what you mean by children. But unfortunately, certainly by the time children are approaching double digits, 10s, and preteens, obesity is becoming a very prevalent problem. And the fact that the prevalence of obesity is about 30% of the U.S. population and the prevalence of fatty liver disease is 30% of the U.S. population is not a coincidence, clearly. So it's essentially, this is mostly a disease of people who are overweight and obese, although not entirely so.
Great. Question about ascites and sodium intake.
Yep.
They don't really specify, but I guess the question is, can you comment about ascites and the sodium intake, and is there anything special that they should do with ascites?
Right. So, I mean, by the time somebody has ascites, unfortunately, they have very advanced liver disease. And as a general comment, taking in sodium, basically the phrase is that the water follows the salt. So if someone takes in a lot of salt, the body's going to retain the water. But somebody with ascites hopefully will have a liver specialist that's following them. So I really won't comment any more than that, but they should really go and speak to the liver specialist.
Super. Does fatigue measure into the determination of how advanced someone's fatty liver disease might be?
Fatigue, of course, is a very general symptom. It can happen for all sorts of reasons. It can happen for, psychological reasons without necessarily any physical impairment. So it's just sort of an alarm bell, if you like. There are way more specific ways of assessing how advanced liver disease is. So there are different imaging tests and such like that would be used. But the main point I wanted to make with fatigue is that, if someone goes from feeling, vigorous and robust to feeling fatigued, if it happens in, over 5 days, then of course they'll notice it. But if it happens over 15 years, they won't notice it. So, my concern is that there are people, in their 40s and 50s who actually are chronically fatigued, but just because it took 20 years, they just sort of think it's normal. So, I'd really like to have my patients sort of feeling, healthy and vigorous rather than just kind of, dragging themselves through the day.
So forgive me, I'm not a medical person here, so I'm not sure how directly relevant the question is, but I'm going to pose it anyway. Can you talk about portal hypertension and bleeds? Is there a relation there to fatty liver disease?
Yeah, so again, this is a situation that occurs in very, very advanced liver disease. So in patients with, very late stage cirrhosis, and the answer is yes. I mean, I won't go into the physiology of it because I don't think we have time. But patients with advanced cirrhosis have elevated blood pressure in a blood vessel called the portal vein, which is what portal hypertension is, and then they're at high risk of having bleeds inside their intestinal tract. But again, anybody who has that level of cirrhosis, you really needs to have a liver specialist looking after them.
Great. So some of these questions are very general, and I believe they were pretty well covered. But I'll just say, is there a general list of foods that are liver healthy and things not to eat? And I believe Jessica, you did comment on that. A well-rounded diet, not eliminating carbohydrates, not eliminating proteins. I think the only thing that you said specifically doesn't add value to your diet is sugar. So if there's anything other than that brief summary that I just gave that you'd like to retouch on or reiterate in terms of a general food list of things to avoid or things to add.
So I would say you want to watch out for processed foods, high fatty foods, alcohol, salt, and focus more fruits, vegetables, lean proteins, healthy fats. There's a variety of foods that fall into that category, but if you're looking for foods to limit or reduce, then I would definitely say, like white pasta, white rice, processed meats, fatty meats, hot dogs, sausage, saturated fats. I think
you said earlier, high salt. I think the top of your list was bacon, and I'm going to have a hard time buying into that one because bacon goes with everything. But
right.
Accepting the fact that bacon is probably not good for you, I guess you probably know better than I, and we'll try to cut back on our bacon too.
Right. So again, in response to that last question, I mean, the message is the same, that, for a perfectly healthy individual or somebody with liver disease, a healthy diet is essentially the same diet that you would tell both of them. It's just that somebody, when they're already ill, really just needs to be much more diligent than a healthy person. A healthy person may get away with, some indulgences, which somebody with liver disease may not be able to.
Great. So here's a question. My husband had liver transplant due to fatty liver. Recently, my daughter has been diagnosed with fatty liver and is overweight. What should she do? I think the answer was pretty clearly lose weight, even if it's just starting at 10% of your body weight. I believe you said was a good starting point to make a large impact. Is that a fair?
Yeah, absolutely. I mean, although most of that data is from adults, I don't know how old this lady's daughter is, but the weight loss data and improvement in liver disease, again, we need to stick with data when we give any concrete advice. The data is in adults. Likely the same thing is true in children, but perhaps this lady's daughter is an adult. The other thing to point out is that there's actually very good data that if somebody has liver cirrhosis from NASH, that their first-degree relatives actually have about a 12-fold greater likelihood of liver cirrhosis from NASH. So, so this particular scenario is concerning, and this lady's daughter should go and see her primary care physician.
It looks like his daughter is 33 years old, so it's not a child.
Yeah. So weight loss.
Yeah. Okay. Great. This is a very general question. I don't even know if you can answer it without the context, but it says here, what determines if you get inflammation?
That's a very good question. So as I said, fat in the liver is actually, I view it as a normal response to overnutrition. It's just that in the olden days, overnutrition was rare, and now it's just all the time. We don't know why it is that about a quarter of that population then goes on to develop liver injury. So that's a very good question. We don't know exactly. There's some genetic factors, but we don't know absolutely.
Okay, so I'm gonna take one more question here, and then we're gonna wrap her up. But I know the answer generally to this question is yes, but I don't. Maybe if there are some statistics that might add to the answer. The question is, does NASH and cirrhosis lead to liver cancer? I know that it certainly can, but I don't know if there are strong statistics on the link of NASH and developing liver cancer.
So NASH leads to cirrhosis, and cirrhosis of all types results in liver cancer. That's just a general feature of cirrhosis, whether it's from NASH or alcohol or some genetic cause of cirrhosis or hepatitis viruses. And patients with cirrhosis have somewhere between a 3 and 5% likelihood of developing liver cancer a year. And that's why they get screened every 6 months with ultrasound. Unfortunately, we are seeing patients with NASH with liver cancer even before they've developed cirrhosis. And again, we can speculate, but we don't know the exact reasons why that might be. Liver cancer is becoming a really major problem with NASH.
Great. Okay, so I'd like to just start wrapping up. I'd like to thank Dr. Mehal and Jessica again for taking the time today. I would also like to thank Alexion Pharmaceuticals for supporting this program for us. There are a few questions that we did not get to. Some were a little bit specific and some came in late. But I would just like to point out on your screen, you should be seeing the American Liver Foundation's helpline. We have trained helpline specialists that can help you with these questions. If they don't know the answer, they can find out for you or help you, point you to the right place to get answers to your questions. So I would encourage you to either call our helpline or you can send an email to info@liverfoundation.org, and our helpline specialists would be happy to try to help you out. We will be posting a recording of this webinar on our website. So for those of you who asked if the slides would be available, we don't have them to send out, but the entire webinar in full will be available on our website, so you can view it and enjoy it for months and years to come. Dr. Mehal and Jessica, if either of you have any closing remarks.
No, but please keep refreshing yourself on this area because it's a rapidly changing area.
Well, and I can tell you that the American Liver Foundation is committed to continuing to provide education and resources for people with non-alcoholic fatty liver disease and fatty liver that is related to alcohol and NASH. So do check in with us if you'd like. You can, through our helpline, through the same email or phone number, you can request to be added to our mailing list and receive our approximately quarterly newsletter and ongoing updates when we have educational programming available. So with that, I will bring the webinar to a close, and thank you all for participating today.
Thanks so much.
Thank you.
Thank you.